A few weeks ago, Democrats were headed into the midterms with enthusiasm and momentum on their side. But Republican leaders, at least, believe that lead largely disappeared because of the Supreme Court confirmation fight of now Justice Kavanaugh.
Well, it certainly energized our voters. They followed it very carefully, like everyone else in America. We knew the Democrats were already excited about this election, but I think now our people are as well. It's been like a shot of adrenaline to Republican voters, and hopefully we can match the Democrats in enthusiasm going into this midterm election.
We welcome now someone who has spent her career in Washington and in New York, in government and in the private sector, and who is actively involved in Democratic House races this year. Most recently, Jane Hartley served as U.S. Ambassador to France under President Obama. So welcome, Madam Ambassador. Good to have you here.
Thank you, David. Wonderful to be with you.
So first address Mitch McConnell's reference to the enthusiasm gap. Where does it stand right now from where you sit?
I think there's enthusiasm and intensity on both sides. I think where he is right in some of the red states, perhaps there is more intensity than there was pre-Kavanaugh. That could perhaps affect some of our Senate races, although we have some great Senate candidates. But where I would counter is in the House races, because most of the House races which are competitive are in the suburbs and the exurbs, and in those races there's a huge amount of intensity and enthusiasm, and it's growing, particularly from women.
So why is it such a different story if you look at the Senate versus the House?
I think it's the geography. I think it's where you're running. I mean, this map, once again, we have great candidates in the Senate, but the map is tough for Democrats. When you look at the map of North Dakota and Montana and West Virginia, our people may pull it out. The Democrats may pull it out because of the strength of their candidates. But the House races, I think Charlie Cook has around 70 House races that he says are competitive. What's interesting there, over half of our candidates are women, and most of them, not all, are in, once again, suburbs and exurbs, and that is an important place right now where you see a huge amount of Democratic intensity, enthusiasm, and once again, women voting and women running.
We're putting up a map right now showing where women are going to appear on the November ballot. Let's talk about maybe the year of the woman. Some people are calling it that, at least. What's accounting for this? What are you seeing?
Oh, it's interesting. I saw a statistic the other day that I was rather shocked at, that 71% of college-educated white women have an unfavorable view of Trump. That is not the case as much with blue-collar women, but 71% is a huge number. I think women are looking to, one, what issues they need in terms of supporting their families. So the number one issue I see out there when I talk to these candidates that are running is health care. Affordable health care. Everybody's talking about prescription drugs. I had one candidate tell me that one of their parents had gotten sick with Parkinson's, and his pills were $1,000 a day. Not just pre-existing condition, which is, I talked to one other candidate who had a child who was sick. One of our candidates who's running in New Jersey decided to get in the race when he had a premature baby who was very ill, and that very day his congressman voted against the Affordable Care Act. So I think in terms of women, it's a couple of things. It's definitely these issues in terms of how do I take care of my family. I think there's also an element of integrity. Maybe we want more integrity in government. Maybe we want more respect for institutions. And perhaps even maybe we want to work across the aisle more than we have been.
So I think you agree with the president, at least on the issue of health care. The president has tweeted this out. College-educated women, which is what you were talking about,
yes,
want safety, security, and health care protections, very much along with financial and economic health for themselves and our country. I supply all of this far better than any Democrat, for decades, actually. That's why they will be voting for me. What is the president getting wrong?
Well, I think he's getting the health care issue totally wrong. I mean, if you go out into these districts, what you hear time and time again is the cost of prescription drugs, that we can't afford it, that people have elderly parents, that they have pre-existing conditions. As you get older, you do have more pre-existing conditions, that they're terrified that their parents aren't going to be covered. Even caps on medical expenses. I heard from one person who once again had premature twins, that the cost of neonatal was millions of dollars, and if the health care plan had not gotten rid of the caps, they would not have been able to afford it. And the twin babies are now healthy and living and very strong.
So you follow these races so carefully. Give us a race or two that you think we should be watching on the issue of women and the issue of health care. What should we be watching when we come to election night to see how it goes?
Well, there's one in Michigan, a woman who actually I knew slightly before. Her name is Alyssa Slotkin. She's running in the suburbs of Detroit. She has Lansing and also a little rural part of her district as well that's a little more red. But she's an interesting example. She was Assistant Secretary of Defense, served 3 terms for the CIA in Iraq, and came home and had never really thought about running. Came home to Michigan and looked around. Her mother had had an issue once again with health care. Her mother had cancer and was worried couldn't get insurance, and it almost bankrupted her. And now you have a person who really thought she would be a public servant or a veteran all her life, and she said, no, I'm throwing my hat in the ring. And that's another point for this year. There are many veterans that have come back, seen what's happening in the country, and it's quite personal. I mean, there's one candidate who's running in the suburbs of Philadelphia, and she said when she woke up on the day after the election, she had 2 people she cared about the most in her life in tears or very upset. Her father, who was a Holocaust survivor, and just wondered if this country was right for him anymore, if it was the values that he had fought for, and her daughter, who was gay. Who couldn't get out of bed, evidently. And she said, you know, this is not my country. And she also was a veteran. And she, too, said, I have to do something about it, and I'm going to run.